Hello, everyone. I'm really thankful to the organizers for this very relevant conference. So, now I'm going to talk about a very important topic on which I penned down something: psychosocial impact on nurses during COVID 19. I believe that this is the pandemic which we all are closely watching because other COVID, other pandemic, which we all have only read about it. We never felt about that particular pandemic. So when we talk about the most relevant thing which WHO launched about sustainable development goals in 2015, which was talking about sustainable development goals, which included multiple development goals, like talking about SDG 1, which was focusing on achieving good health and well-being, then talking about SDG 3, which was talking about ensuring inclusive and equitable education. Achieving gender equality was the SDG 5, and SDG 8 was talking about promoting decent work and inclusive and sustainable economic growth. So basically, when we talk about SDG 3, which was denoting universal health coverage, which talked about multiple things, and therefore WHO has already declared year 2020 as the International Year of the Nurse and the Midwife. Now, when we talk about such an important strategic theme given by WHO for 2020, why nurses are considered to be so important? So I wanted to specify here, although nurses are the frontline warrior, but they are facing harsh challenges. Now, when I say harsh challenges, few of the challenges I have referred into this particular PPT, that is talking about shortage of experienced nurses in the hospitals and clinic, then shortage of PPE and mask, which we all have seen during pandemic, and talking about unavailability of accommodation, transport facilities, inadequate quarantine facility, physical exhaustion and mental stress because very long duration of working hours they are having, lack of health insurance coverage, and most important part is the communication gap. Now, when I talk about the communication gap, it refers to the communication which should be the lifeline of the nurses with the hospital authorities and the leaders, but it is not happening, and that's why it is resulting into the frustration and mental exhaustion, and which is not good for the nursing profession. Now I wanted to talk about little brief and background of the nursing profession. WHO has launched triple billion target, which talks about 1 million more people benefiting from the health coverage, 1 million more people better protected from health emergencies, as well as 1 billion more people enjoying better health and well-being. Now, when we talk about nurses' responsibilities and diverse role in healthcare industry, they are playing a very important role by critically fulfilling their responsibility for multiple roles, like they are acting as advanced practitioners, clinicians, leaders, policymakers, researchers, scientists, and teachers. Now, when we talk about such a multifaceted role profile which the nurses are having, then the most million-dollar question happens: why these challenges, why these harsh challenges they are supposed to face? There are certain loopholes in the regulations, in the policy, in the administration, which is the that's why the nurses are becoming the victim of this. Now, when I talk about the WHO, who has launched triple billion targets, here see in this particular diagram, which is talking about nurses are a very important part of multidisciplinary teams. Now, they are playing a very important role in fulfilling the universal health coverage because they are the front line provider of primary care, offering care across the life course from birth to death. Emergencies, epidemics, and disasters, they are the one who are the most important connecting link in providing the treatment between the doctor and the patients. In health and well-being, when we talk about, they are addressing multiple features of the climate change, talking about the ensuring access for vulnerable groups such as women and youth. So they are very important pivotal point when we talk about for achieving the triple billion targets launched by WHO. Now, nurses have already played a very pivotal role in managing various epidemics which happened in 2014 when we're talking about Ebola virus disease. then MERS-CoV in 2015, Zika virus disease in 2016, and now currently we are all seeing COVID-19, which break in 2019. I wanted to highlight here a very important uh, story about the Japan. Japan, which is generally considered to be super aging society, in 2014, Sasakawa Memorial Health Foundation, they became a very important program where whole sole objective was to establish and operate nurses as a community-based home care nursing center, and these center will be providing these services to the aging adults to live with dignity at home and to improve the quality. And now this particular center was responsible to run the network which can enhance cooperation between centers, collecting the data, advocating establishment of community-based home care nursing centers. And this 8-month program in elder care and home care nursing was preparing nurses to conduct physical assessment, meet the primary healthcare need of the community residents, and also assisting families to provide palliative and end-of-life care in the home. By March 2017, approximately 2019, 67 nurses were completing their program, and 56 of them had started operating home care nursing center in 23 districts through Japan. So the basic objective of this particular program was not only to enhance the skill of the nurses, but also to empower them so that they can independently run these centers. And that was a very unique form of community run service center developed by the Japan in the super aging society. Now moving further, when we are talking about there's a huge requirement for the nurses in high income countries. Now why it is so? Because there are certain statistics which I have mentioned on the slide, which is talking about Health Foundation in the United Kingdom estimate a need to recruit at least 5,000 nurses per year from abroad until 2024. Then in Japan also a new visa program was enacted to attract up to 245,000 foreign workers, including 60,000 nurses. Similarly, German government also reported approximately 36,000 vacancies in elderly and sick care, noting that they would be needing to recruit from abroad. Thus, we are talking about when we are talking about the wide variation in density of nurses personnel in low income countries. If you see here, the most important density which was identified was in the Western Pacific region, whereas it was very less found in the low income countries. So it was a very huge requirement that how to have in this particular way. Now, if you see here, the projected increase of the nursing stock by the WHO region and by income has been highlighted on this particular slide. Number of nurses graduate would need to increase by 8% per year on average with better employable skills. So here when we are talking about America is having the highest skilled nurses by region when we're talking about, whereas upper middle income group, when we talk about, they are referring to the maximum number of the nurses. So ultimately, nurses are playing a very pivotal role in primary healthcare center, and one nurse out of every 8 practices in a country other than the one where they are born or trained. So migration is on a higher side of the nurses. Retention of the nurses is a near universal challenge. Now, why it is a near universal challenge? Because if you see here, almost there is a minimum duration for the nurse education is a 3-year program across globe. When you talk about from Africa, America, Southeast Asia, Europe, Eastern Mediterranean and Western Pacific, it is lasting like that only. Then percentage of the female and male nursing professional, obviously there's a dominance of female gender in nursing profession. When we talk about, and 95% of the nurses are in the Western Pacific, whereas the lowest one is in the African continent, that is 76%. Now, percentage, when we're talking about 95%, the same thing is highlighted on this slide. Western Pacific is having the 95%, and Africa is having the less percentage of the nursing personnel. Now, when we're talking about the important vital statistics about the age demographic, 38% of the nurses are below 35 years when we are talking about the global data, as well as the nurses, the age less than 55 year is almost 18% only. So it means that when we're talking about more younger demographic is working right now in this nursing profession. Now, this is a very important slide which is highlighting that although 86% of the countries have a governing body for the regulation of nursing, but when we are talking about regulation on working hours and condition, only 133 countries out of 142 have justified that yes, they are having this particular phenomenon. Then regulation on social protection is also only 125 countries out of 137 have spoken about it. The regulation on minimum wages, only 119 countries are indicating about this out of 134 countries. Nursing Council, 144 year, yes, out of 164. And then talking about existence of advanced nursing role, it was very less, that is 50 countries out of the 95, they said yes. Then measuring to prevent attack on health workers, 20 said yes out of 55 countries. So all these statistics, they talk about there's a huge requirement to manage the rules, ethical guidelines for the nursing profession. Because when you talk about the health worker industry, there are 58%, I'm repeating, there are 58% of the health workers are nurses. So they are the widest working population in the healthcare industry. So there is a massive requirement to have very stringent regulations so that the nurses should get their adequate right and they should also have the better quality of life. Now, talking about duration of pre-service education, when we're talking about globally, global average is around 58% when we're talking about, and it is maximum in the case of Western Pacific, which is talking about 78%. This is a prerequisite requirement when somebody want to take the profession of nurses. Now, I wanted to highlight here a small study conducted at the UK for assessing psychosocial implication of COVID-19. This study was conducted in the dental healthcare workers, and there it was demonstrated. A survey was conducted with a series of questions which was denoting generalized anxiety disorder assessment and was distributed to members of the dental team between 1st to 3rd April 2020, and the result was identified that there was highly anxiety level and very much significant psychosocial implication was noticed. And in this particular setting, fragility, conflict, health workers including nurses, and personal and professional challenges were identified. And there are certain psychosocial implication which was highlighted in this study was threat of abduction, having to cope with the death of colleagues, fear of their own death, increased workload, increased complexity in the workload, erosion of ethical and professional standards. So they are on a very serious kind of the implication which was noticed in this particular small study. So now talking about another study which was talking about there are various symptoms of burnout in the health workers when we're talking about especially for the nurses. So there are series of the burnout symptoms. Now we have categorized, researchers have categorized into different categories, psychosocial, psychophysiological, psychological, and so on. So first talking about the psychophysiological, as rightly you all can see in the slide, which is talking about starting from tiredness, gastrointestinal disorders, weight loss, coronary heart disease, breathing difficulties, and general pain. So they were highlighting the psychophysiological, whereas psychological symptoms were like emotional exhaustion, decreased self-esteem, being suspicious and anxious, helplessness, easy crying, irritability, and quick temper. So they are highlighting psychological. Now moving further, behavioral when we talk about, it is reflecting the physical and psychological distancing from patients and postponing work and deterioration in the nature of the service offered, deterioration in the relationship at work and outside work, decrease in job performance, job dissatisfaction, conflict with the family members and friends, increased use of drug, alcohol, and smoking. That was the behavioral burnout symptoms. So when we are talking about these symptoms, which was ultimately indicating that nurses are having very hectic schedule, and therefore these symptoms are going to take huge toll on their life, and therefore a research study has highlighted these 9 evidence-based organizational strategies which are suggested for reducing burnouts. Now here, these strategies are very simple and very practical, starting from acknowledging and assessing the problem, then harnessing the power of effective leadership, developing and implementing targeting interventions, cultivating community at work, using rewards and incentive wisely, aligning values and strengthening culture, promoting flexibility and work-life integration, providing resources to promote resilience and self-care, facilitating and funding organizational science. So when we talk about these 9 interventions, 9 intervention strategies which are suggested, if they are implementing properly, nurses can be at ease. They can be more focused on their job, and definitely they are the real asset in serving the humanity, and especially during testing time period like COVID-19, which we all are seeing right now. Now, to reduce the effects of COVID-19 in other countries, counseling was getting more emphasis. Psychotherapy services, peer support program, regular meeting time, psychiatric teleconsultation helplines. Now, psychiatric teleconsultation helpline, which is round the clock run by these authorities, so that any given point of time, if the nurses want any type of help, advice, they should be dialing this particular number and they should get the adequate facility. Now, the challenges. The most important challenges to the nursing profession are facing overwork, stress, difficult ethical decisions, and multiple deaths. Now, in the end, I wanted to highlight this. These are the suggestion which was given in the report, State Council of the report, future requirement for improving the state of nurses. Now, for this, a huge collaboration is required between the hospital authorities, between the those colleges, nursing counseling colleges, which should be very much talking about the legal implications, so that the things can be streamlined properly. So the countries which are getting affected by shortage has to need to increase and educate and employ at least 5.9 million additional nurses. Countries should also strengthen capacity for health workers, data collection, analysis, and use. Then nurse mobility and migration. As already I told you in previous slides, that 8% of the nurses, they are the only one who are working in their hometown, home state. Otherwise, they are shifted here and there, and that's why the migration rate is on a higher side. And when migration rate is on a higher side, then it should be effectively monitored so that it can be managed also ethically. Nurse education training program must graduate nurses who drive progress in primary healthcare and universal health coverage. Nursing leadership and governance is critical to nursing setup. Planners and regulators should optimize the contribution of nursing practice. Policymakers, employers, and regulators should coordinate action. Countries should deliberately plan for gender-sensitive nursing workforce policies. Professional nursing regulation must be modernized. Collaboration should be definitely a key. So when we're talking about that, how it can be reduced the psychosocial implication of the nurses, it can be done until and unless it is implemented properly and stringently. Then only the things can be controlled. So in the end, I wanted to show you the references, and now I'm more ready